for me, I feel like I think we're at sort of the end of the research arc of the revolution of sort of efficacy research. It's still being promoted and pushed because it's a great way to sell a drug.
Right.
If I'll just map, the difference between efficacy research and effectiveness research is that effectiveness really looks at a therapy or a therapeutic approach.
Clinical significance.
Like, was I able to affect a positive change in a patient population using a technique or a way of formulation or something like that? It doesn't require this efficacy model, which says, is this molecule effective for this condition? And that's a great way to sell a drug, and there are cases where we can still really use that, especially
Right,
in cancer. There are some places where targeting a specific, molecular receptor or a pathway can be very powerful in a disease process like cancer that gets out of control really easily. But I want to find out, how is cannabis effective and how is plant medicine effective for different conditions when applied using some principles, like using some basic, approaches to medicine. And so I want to see a divergence in how we prove something's value as a medicine. And I feel like we're stuck in a place where the money and the cash grab is driving us to keep using this archaic model that was really, a model set up in the, 30s and 40s of, to prove out these pharmaceutical medicines and that they were powerful because they were going to direct function. Right. We want to be in control. And in the emergency room, heck yeah, I want to be in control in the emergency room,
Exactly.
Someone comes
It's
in with acute chest pain. Man, let's get them on nitroglycerin. Let's throw, these guys got an ST wave, elevation. We've got, this person's having a cardiac event. We need to get them taken care of. We need some single molecules to block some pathways and keep them alive. Awesome. But where I see cannabis and where I see plant medicine is in day-to-day health. And we don't need to use that model to understand how those things affect our health and disease,
Right.
And so I don't know how to make that bridge, but I'm pushing for my own work and my own, search for meaning and search for what am I here to do. I want to try to help proliferate a way of approaching medicine, a way of proving that looking at a person's lab work, combining it with looking at their Chinese medicine diagnosis, and then using natural materials, maybe some drugs too if they need them, but whatever, but a combination, but that approach would be effective for patients. And how do we move from the efficacy of that single molecule single target to a more, what I would call a more useful and pragmatic,
Right.
research approach?
Yeah, a much more individualized approach. So, some of the folks that I've talked to so far have gone into this direction too, talking about, to get to that, there has to be a focus on the patient and their circumstances.
Not the disease, right?
Right. Yeah, exactly. A much more integrated model of what's going on with the patient, and not just sort of having this tunnel vision of focusing just on a single condition and how to influence those symptoms, or that pathology, but taking those blinders off and looking at the person as a whole person and taking their lifestyle and all these different influences of what they're dealing with and trying to, but that takes a lot of time. And that's, the problem with the current healthcare model is patients don't have that much time to spend with doctors, because doctors are having to cycle people through. They have 10 minutes sometimes.
That's pretty much standard, right? 10 minutes, yeah.
And so in order to get a full picture of somebody, it means that you can't have as many patients, and that you're going to have to do a lot more monitoring. It takes a lot more critical thinking to balance all of these pieces. And I think something you said is really important about being open to all of these treatment options, so not excluding pharmaceuticals, recognizing that they do have a role in certain situations, and trying to understand that balance of getting all of this incorporated, the lifestyle, the diet, supplemental herbs and things to influence someone's natural states, or whatever they're trying to go through, and recognizing the role that pharmaceuticals have, and not trying to, one issue that we have in the natural products world and in sort of herbalism and everything is sometimes there's this kind of intense tribalism. It's like we're so anti-pharma, like we will
Right,
not engage pharmaceuticals at all. And I don't think that's a useful approach. You've got to understand, like you started off saying, this pyramid, this spectrum, that it's all a part of health and wellness. And one thing that I've visualized is, it's like we're going through these pendulum swings, and starting in the early 1900s, there was this swing away from uncontrollable medicines and variables and everything towards hyper standardized, hyper controlled research models, and going towards single ingredient, single active compound ways of thinking. And now it seems like the pendulum's swinging back towards thinking about things as cultures used to, about getting back into traditional Chinese medicine and everything, getting more into that holistic picture again. And it probably won't swing as far as it started, but it's going to oscillate.
Yeah.
And
I'm feeling that.
until it comes towards some more happy medium, some synthesis between these different perspectives, and recognizing under what circumstances to engage all of these tools.
Yeah, I think it's well said. And, I think you said, I think that's one of my missions in life is to bridge those worlds. And I think one of the things that came in my mind as you were speaking was the word alternative, right?
Right.
And, cannabis, of course, was part of alternative culture, counterculture for a long time. And so it still kind of gets put into this alternative medicine realm. And I think one of the things that's been really alarming to me as a person who spends most of my time in the field of medicine with cancer patients, is that about 8 years ago, people started coming to me saying, hey, I need help. I'm going to cure my cancer with cannabis, with marijuana. And I would say, really? Okay, what's going on with that? So I started seeing more people would call me like, oh, I heard that some things about cannabis, and that, you could help me. I want to cure my cancer with cannabis. And I was like, well, okay. I mean, it sounds like the next silver bullet to me, which doesn't exist, right? Cancer is an incredibly complex disease. People are complex organisms. How can one thing do all of that? Of course, as time came to bear, I saw that a lot of people died, literally, and I would advise them, hey, I think you need to, really consider some oncological therapy. We need to, you're losing the momentum here, and it's a momentum game with cancer. It's trying to gain enough of its own resource generation and using what you have faster than you can maintain your own resource to build yourself. And there's this crazy struggle there. And if cancer starts winning that battle, it's really hard to turn it around, even with really powerful plant medicine or any kind of thing. Sometimes you just need, you need an intervention like a targeted therapy, an immunotherapy, a chemotherapy, even radiation in some outside, cases, or surgery, to debulk it and then go after it. And, I'm very selective and very specific about my choices, especially when it's concerning the life of someone and then their family and how it affects their community. It's a big deal to make a choice. And so, I got really put off by the fact that there was basically one person promoting, sort of like this path to curing cancer. I'm not gonna say any names, but it was like the idea that this person cured their cancer. Well, they cured basal cell carcinoma, a skin cancer that's basically you just cut it out and remove it. I can put, bloodroot and turmeric on it and just have it come out. I've just seen so many of those go away, but they're taking that and then interpreting it as, oh, cannabis cures cancer. And to me, it speaks to a deep loss of hope, a loss of a sense of, I can do this, or I'm empowered. I need, everybody feels like it's so disempowering to have to go and become the thing that needs to get help, like to get big money and big therapy to treat you. You like, oh man, I don't want to do that. I'm scared of that. So I need to find the thing that's going to cure me. And it's a very revolutionary thought. It's a very rebellious thought. And I feel it too. I really want there to be, a cure for cancer.
Right.
But there's no cure for cancer. It's not, you can't cure cancer like in one, it's like it's an incredibly complex thing. And I would love to elaborate on it at some point, all my kind of like 7 different sort of metaphors of cancer, as I call them, how it relates to as within, so without, and how cancer manifests, and then how we have to address it. And of course, prevention. I mean, that's what we can do. We used to talk about an ounce of prevention is worth a pound of cure. In cancer. My adage is an ounce of prevention is worth a ton of cure.
Yeah. Yeah.
Because the cure is
so challenging,
damaging
Yeah.
and challenging. Oh my God, like, people, it's a long story, but swinging back around, I think that was the thing that concerned me the most about cannabis, was that, wow, people are going to take this medicine and they're going to fill their desire and their need to have that hope for the cure for all of what ails us. It's never going to be that. I don't care what it is.
You're right.
Cannabis just filling it's just the next thing to fill that void in us. And the void is only filled by us changing our approach to life. We are the problem, right? Whether it's from overpopulation to microplastics and, all pollutants and right? It goes on. And so cannabis has a role to play, and I want to help find what that role is. And I want it to find a place where it's well understood for what it can do and what it can't do.
Yeah.
What its strengths are and what its weaknesses are.
Yep.
Where it could actually hurt someone,
Yes.
because everybody looks at it as it's got this sort of, and natural medicine had that for a long time too, of like, if it's natural, it means it's good for you.
Right,
Are you kidding me? Digitalis is a great plant, but you walk out in there, grab one flower, you're dead.
Right.
Like that, I'm sorry. That's, we need to, this is real.